Hey, I'm here with Dr. John Minichetti, the Implant Daddy. How are you, John?
A pleasure. I'm doing great, buddy.
And I have a question. Zirconia or hybrids?
Zirconia or
Hybrids,
hybrids on
yes.
your bridge work?
On
Okay,
your
go.
bridge work,
Okay.
exactly. What can you tell me the good and bad things about putting or placing a zirconia? Because everyone sells zirconia.
Yes.
And it's like selling Ferraris.
Yes.
I mean, everyone loves the Ferraris and everyone wants a Ferrari.
Yes.
But you live in Ohio and the road is not good.
Yes.
And they're going to sell you a Ferrari. What's going to happen? If you're a strong biter, you have bruxism.
Yes.
And they're going to put a...
Zirconia.
Exactly, zirconia. What's going to happen?
Well, you'll definitely get more load. You'll definitely get more load on the zirconia. The advantages and disadvantages of zirconia versus the hybrid. The hybrid definitely will be better absorbing load. Okay, softer on the implants. The disadvantage, it may stain or something as such if it's not maintained, of
After
course.
5 years.
But at least it's repairable.
Yeah.
Okay. So the advantage of the zirconium is that it won't stain. The disadvantage is it does put increased load and it's not repairable.
How many years you have been placing implants?
40.
40 years. So you have done all types
Yeah,
of
I've done
materials.
all that. Yes.
Do you
Correct.
think that it's best? Like if it was your case, what would you do? Zirconia or hybrid?
It
I mean, your
depends
case,
on the
on you.
case. On my mouth?
On your mouth.
Oh my God, I can't even answer that.
See? that's why I say that. I mean, if you have a good condition bone,
Yes.
well, yes.
Yes.
But usually our patients, they are not like in a good condition. They are like, see yourself in the mirror. Probably if you're watching this, it's like see yourself in the mirror. I have lots of patients that they have really destroyed periodontal disease and all that, and they want zirconia. Even without drilling the bone, what I tell them is like it could be concrete, it could be wooden, or it could be a drywall. And you will never know until you drill.
Yes.
Sometimes what happens with the bone, you start to drill and what happens? Zit.
Yeah, it's very
You just
soft.
go like that and,
Very
and you
soft.
promise zirconia. That's
Yes.
going to be an overstress of the bone.
Yes.
So in your those 40 years placing implants, what's the percentage? How many zirconias? How many hybrids?
Well, the zirconias are newer, of course. So
Yeah.
we've been doing those more recently. So, but I have many hybrids out there for many years.
And do you think there's a lots of rejections of implants because overstress with zirconia or not?
I don't know if the information's out there really for that because I know you can get failure
It's
with
new.
both.
I
Yes.
know.
You can get failure with both. So I think that's yet to be determined.
But there's more overstress with zirconia?
For sure. Yes. For
Rather
sure.
than hybrids?
Yes, because it's going to be less flexure.
If you want to protect the implants,
Yep.
like if they were the babies.
Less flexure with
Less
zirconia.
flexure.
Absolutely.
So that's one of the things. So for patients that they ask, well, you can do any of both, pay any of both,
No.
but it's not for everyone. Like the Ferrari that I was saying.
It should be case. Everybody's individual should be case like.
Exactly. Like if you want to buy a Ferrari, but you want to use it like a taxi
Tractor.
driver in New York. So it's like, what's going to happen? Well, you're going to break it
That's right.
in 1 month. So thanks for answering
Of
me
course.
those questions
Of
because
course.
there's many questions about that. And you do lots of hybrids in your office and lots of zirconias.
Yes.
So,
Yep.
Dr. Minichetti, the Implant Daddy. Thank you, my friend.
My pleasure.
Thank you. My pleasure. Bye-bye.